Hello, my name is Keosha Taylor. I currently work as a registered nurse in a mental health hospital, and it is an acute care setting. It does have all age groups in this hospital. I used to work with only the adolescents, but now recently I have been working with adults, and I do work on a very high acuity unit, so oftentimes we're very busy, and there are a lot of behaviors and there are a lot of different mental health disorders from schizophrenia, bipolar. Some people have some adjustment disorders. We have some other patients that have OCD, just a lot of different diagnoses. I enjoy this job. I love it very much because ever since I started working in mental health, I just feel like it gives me a different outlook on life. I had never done mental health in the past. I used to work with the geriatric population, and I also did dialysis for a long period of time. I also did school nursing, but this is different for me, and I love it. I fell in love with it, and this is what encouraged me to want to become a psychiatric nurse practitioner. Some topics that do make me a little anxious and I'm a little bothersome about with mental health, and probably with my upcoming clinicals as well when working and talking with patients. My biggest thing would be those who have had sexual allegations and those patients who have been abusers to others sexually. Not really as much physically emotional abuse, but sexual abuse. I do believe most of that is due to some of my childhood trauma. It wasn't myself, but I had a family member that was sexually abused, and I was present when she was kidnapped and taken from us. We did get her back, but it was very traumatic for my family and myself, as I was only 6 and she was 8. And that is why I do feel that that area makes me a little anxious. I do know I have to grow a level of comfort with those patients because at work I have to deal with them every day. So even though I know how I feel deep inside, I do have to have on a poker face and be as professional as possible with them. I would say that is one of my only triggers in mental health. Everything else I can kind of work with and be okay. But that is one of the biggest things that brings up my anxieties. But I will say one of the best ways I think that'll help me overcome this would be just to get in there and do it, because there's really nothing else we can do. We have to work with these patients and give them the care they need. And I don't want to be the specific type of nurse practitioner that picks and chooses what patients I do and don't work with, because I want to do this for the greater good. Even though they do have some sometimes brutal backgrounds, we also can be helpful to them. Even though I don't feel that many of them, there isn't much help you can give them. I do feel like there's some help they can get, but I do feel they always do have those thoughts in the back of their mind. Because, I mean, this is a mental health disorder that they really do have and that they're battling as well as me trying to help them. They're battling, trying to sometimes help themselves, and it's hard for them because some of it is caused by their trauma. So I think that's what makes it a little bit easier for me, because I do understand that a lot of them are living a lot of what they've learned in their childhood, even when they were older. I hope to learn as much as possible in this current course, as well as in my clinical rotation. And I hope to watch everyone else's videos and get as much information about you guys so we maybe can help each other in different ways. And I'm just excited to meet everyone. Thank you. Bye.